I'm going to begin sharing with you the specific interventions that we might bring into a therapy session using experiential somatic approaches. The specific interventions that we're going to be bringing into our therapy sessions, though, are probably going to fall into 5 categories or 5 types of somatic interventions. I've expressed this with an acronym, BALMS, B-A-L-M-S. And the reason why is simple. Think of a lip balm for chapped lips or a skin balm for irritated skin. Balms provide soothing relief. They bring a sense of healing to a person. And what we're doing when we're creating experiential somatic interventions with our clients is we are literally creating a psychological and physiological balm for the traumas, the stressors, the anxieties, the depressions, and the difficulties that they've been experiencing. Now, I want to point out a couple things that are important about this framework of the 5 different categories. Some of the interventions might actually draw from 2 or maybe even more of the categories. That's perfectly okay. Sometimes they do overlap a little bit. At the same time, there are probably some interventions that we might create that we might bring to the process that actually don't fit within each of these 5 categories. But broadly, for the most part, the interventions that we're going to create are going to fall into these categories. So let's take a look at the first one, the letter B, and this is breathwork and autonomic regulation. So healing breath, deep breathing. You can think of this in a way that's very similar to what people practice in yoga. In fact, there's a body of evidence out there that shows that yoga breathwork exercises are extremely helpful for people who have post-traumatic stress disorder. In fact, there's a body of evidence out there that actually shows that specifically for veterans with post-traumatic stress disorder, this is a very effective intervention at helping them to deal with the physiological distressors of their diagnosis and of the problems that are causing them so much stress. So what type of breath work might we use? Well, one of those techniques is diaphragmic breathing, choosing to breathe from the diaphragm rather than breathing up with the chest. A simple way to do this is go ahead and take in a deep breath right now. Just go ahead and do it. Take in a deep breath. And what most people do is they tend to puff up their chest, put their shoulders back. This actually creates stress in the upper body. It also restricts movement of the airflow to the lower part of the lungs. Another way to do this would be to instruct a person, and you can do this at home while you watch this video, to put your hand on your belly, to close the eyes down for a moment. And with the eyes closed down, imagine that there's a helium-filled balloon in the stomach, but it has no air in it. It has no helium in it. Imagine now breathing in by filling up that helium-filled balloon. Go ahead and do that. Breathe from the belly, and now exhale, letting the air out of that balloon. And what did you notice? You notice that your breath came from the diaphragm, the deepest levels, allowing air to go into the deepest part of the lungs and provide oxygen to every cell of the body. This is a way to calm panic, to calm distress, to seize control over the feeling of overwhelm. And when people practice diaphragmic breathing, the research actually shows that they have a tool that can help them proactively deal with the stressors of either their previous experiences or become resilient in the face of new experiences. Another technique of breath work that can be valuable is a strategy called box breaths. This is based on 4 principles. Inhaling, and let's count to 3. 1, 2, 3. Holding the breath, counting to 3. 1, 2, 3. Exhaling, counting to 3. 1, 2, 3. And then holding the exhale. 1, 2, 3. So we have essentially a box, 3 or 4 equal sides, each a 3 count. Inhale, 3 count. Hold the breath for 3 seconds. Exhale for 3 seconds. Hold the exhale for 3 seconds. Practicing these types of strategies can help a person to take physical control over their emotional experiences. Alternate nostril breathing is another strategy. We don't think about it very often. That's why this strategy really combines with mindfulness, where a person chooses to pay attention to their breath and which nostril brings in more air, and what it's like in the nostrils to exhale. There are also strategies that are used in somatic therapy that combine vocalization with the breath. One of my favorite strategies from Peter Levine is by using the sound voo, like a foghorn, as an exhale. These type of breathwork strategies, in this case combined with vocalization, can have profound results and help a person to integrate their emotional states and their emotional experiences with the physiological processes that promote health. The research shows that these types of strategies regulate the autonomic nervous system, that they can improve the heart rate, that they foster a sense of resilience, and systematic reviews show us that this type of breath training or breath work that we can bring into the process with our clients can help them manage their level of stress in numerous different situations, including those stressors brought about by mental health related concerns, episodic stressors, health related stressors, relationship and social stressors. The next letter in our acronym is A, and this stands for awareness and grounding. Experiential somatic therapies pay attention to the idea of grounding and awareness. Awareness both to the self as well as a connection, or I think a unity, to the world around us. We can think of it this way. When we practice a grounding exercise, when we practice a mindfulness exercise, what we're doing is we're helping to facilitate an understanding of the unity of mind and body, a connection to body and earth, a connection to earth and universe, in seeing ourselves as something present within the context of something bigger, safer, and ever present. This is really an important concept, and with the clients who I've worked with in therapy over the years, I've discovered that one of the most valuable things I can share with them are grounding techniques. When I'm doing hypnotherapy with my clients, I integrate grounding throughout my hypnotic pattern. I often say to them, and as you pay attention to the chair where you sit, to your feet on the floor, to your chair on the floor, and to your feet and the chair connected to the earth below. This is, again, simply a grounding exercise. I use mindfulness in my hypnotherapy and as well as my traditional therapy sessions by saying to my client, and with the next breath in, as you breathe in, pay attention to this moment, each breath marking each moment. These types of suggestions, whether given in hypnosis or given in traditional therapy or coaching or really any other helping endeavor, are grounding exercises that help to promote awareness in a way that our clients previously have not experienced. One of these strategies is the body scan exercise. Again, I will develop greater attention to the techniques of these in future tutorials and future videos and in future classes. But the basic of a body scan intervention has a person scan their body to become aware of what their body is experiencing in the present moment. You can think of it this way. Pay attention to a place in your body right now where you're carrying the tension of your day. Just scan your body and notice where you feel the tightness or the tension physically in your body. Go ahead and do that now. No doubt you were able to identify a spot in your body, whether that was a headache or whether that was a pain in the shoulders or in the legs or somewhere else in the body, a place where you're carrying the tension of the day. But until I asked you to bring your attention to that, you were probably unaware that your body was experiencing that somatic experience of the tension of the day. And yet you were able easily to identify it and attach that physical feeling to the tension of the day. So a body scan intervention would be one that guides the client through the process of paying attention to each part of the body and simply asking, what is this part of my body experiencing in the current moment? This could be similar to a progressive muscle relaxation process where we pay attention to the muscles. We can pay attention to many other things in the body as well. We can pay attention to our skin. We can pay attention to our gut. We can pay attention to so many different areas and places within the body. Mindfulness meditation is a well-researched intervention that has proven to be effective for dealing with anxiety, depression, anger, a wide range of difficulties that clients might present with. Mindfulness is useful for habit change. It's a strategy I teach every one of my weight loss clients. I teach them how to do and practice mindful eating. It's something I help my substance users and my tobacco smokers to learn and focus on. Because in this moment, marked by this breath, it's easy for me to make a choice that's healthy for me. Even if the thought of doing something the rest of my life is something that seems overwhelming to me. When you talk to addicts about quitting, it just seems so overwhelming. Never drinking again, never smoking again. It just doesn't seem possible to them. But AA got something right, one day at a time. This breath marks this moment, and in this moment, I can choose to just be present without taking an action that's detrimental or unhelpful or non-resourceful to me. So mindfulness-based interventions really are a set of strategies that we can bring into experiential somatic therapies because they, again, deal with both the psychological and emotional experiences that a person is having, as well as the physical experiences that they're holding on to. Again, tons of research in trauma recovery and mindfulness, addiction and mindfulness, cancer recovery and mindfulness. Jon Kabat-Zinn has spent his entire career researching at Massachusetts General Hospital the impact of mindfulness-based stress reduction in improving the quality of life. One of the great things about the awareness and grounding exercises in experiential somatic therapy is that they facilitate neuroplasticity. They facilitate the ability to create changes within the brain structures themselves so that new experiences or new challenges or new difficulties are processed by both mind and body in a new way, changing the outcomes of previous traumas and again creating resilience in future situations of difficulty. Now we're going to talk about my favorite of these 5 categories, and that is loosening movement and physical expression. One of the things that I've discovered in the work that I do is that I need to give space to my clients to create a sense of looseness in their bodies. You see, stress, anxiety, trauma, it creates tightness, it creates restriction. The opposite of that is a sense of loosening. With many of the clients who I work with, I use postural swaying, asking them in their chair or even to stand and to simply move left to right, to allow their bodies to move as they create and describe the emotional experiences they have. I will often give them the direction that, like a tree on a light and breezy day, again, I don't want to create a windstorm or hurricane, to allow the body simply to move. This is a way of processing difficult emotions. If my client is experiencing extreme anxiety or extreme tension or extreme anger, as you describe the emotion to me, allow your body to sway. And what happens is a state of equilibrium automatically becomes present. And just like a tree on a windy day, eventually the movement stops between the gusts of winds, and their bodies, without direction from me, find a place of quiet. It's through this process that my clients can gain benefits and insights into their somatic manifestations of the emotional, the psychological, the cognitive, the social issues that they've been experiencing. Physical movement allows my clients to process emotions, to release tension, to find a state of equilibrium, and to improve their awareness. These are key skills that are necessary for resilience and for overcoming the traumas, the stressors, the mental illnesses, the difficulties, the resistance that we often have in life to being able to create new experiences and live life from a different perspective. So flexibility exercises are something that I might bring into my sessions, just like that postural sway technique. I've had many clients who've come to me and say, oh, like Tai Chi. Absolutely. These are movement exercises that can help a person to develop a sense of flexibility. When my clients come in with constricted emotions, I want them, rather than telling them simply to feel different or do something different, I ask my clients to move into something different. And that can be a really powerful tool in somatic experiential therapy. Postural awareness is another tool that can be used when it comes to loosening and movement and physical expression. We often carry our emotions in our posture. I ask my clients to sit on the edge of the chair to allow their bodies to be in alignment. This physical alignment allows them to be able to create emotional alignment as we process the therapeutic issues in whether it's a therapy session or whether it's a hypnosis session. Sensorimotor activities are super important. These are somatic movement processes that allow a client to begin processing trauma. They are a part of the BALMS process or the BALMS framework, and they can be extremely helpful in helping my client to engage in what are called somatic exercises. These are movements that are not just focused on the external experience of the body, but on the internal experience of the body. As a hypnotist, I work with a lot of clients who come to me with chronic pain, functional pain. Functional pain is real pain that doesn't have a medical explanation for its cause. I have clients who come to me with conditions like Crohn's disease and irritable bowel syndrome and other gastrointestinal distressors. And somatic exercises can help my client to begin to focus on the internal sensations that their bodies are experiencing. And again, in many cases, our clients have been going through life without these awareness, and awareness alone can often be an effective intervention. There is qualitative research that supports the loosening movement and physical expression framework here. It improves emotional response. Qualitative research shows that it improves both physiological as well as emotional well-being, and that there are significant benefits of loosening movement and physical expression in therapy, specifically to trauma clients as well. The M in this framework is manual and self-administered touch. Now, one of the things I want to stress is that my preference is almost always for self-administered touch in the therapeutic process. We live in a litigious society. We live in a society where something misconstrued as it is not can be as problematic as a touch that is an unethical form of touching. So in my therapeutic processes, I rarely touch my clients. If I do touch my clients, it is a non-sexual, non-shaming touch with a therapeutic purpose. And I ask my clients for consent before I touch my clients. This is particularly important in hypnosis. Before I begin a hypnotherapy session, I might tell my client why I might touch them and ask for permission to touch them. So for example, I might say to a client, and during this process, I'm going to have you lift your arm. And as you lift your arm, I'm going to be tapping on the back of your hand. This is going to be creating an anchor. Is that something you would be comfortable with? Getting this consent and also telling our clients informed consent what it is that we're going to be doing during our processes are extremely important. There are, of course, some therapists who have a license to touch. These include massage therapists and physical therapists. And because of the type of work that you do, manual touching and manual movement and manual therapies, a chiropractor is another example of a person who has a license to do this, maybe in line with the type of work that you do. But as a hypnotist and as a licensed marriage and family therapist, it is not something I typically do. And so what is it that I bring into the process related to touch self-administered touching. And this can come in a number of different forms. Self-soothing is one of these forms. I'm going to teach you a process later that I call the 3-2-1 emotional reset. During this process, I have my clients take their two hands and put them just like this. Begin to tap just like this. By the way, this introduces bilateral stimulation into the process, a process similar to that of EMDR. It's based on the idea of bilateral stimulation and maybe even petting themselves. This is a process similar to what is referred to as havening techniques. These are self-soothing techniques. Many of the clients who I work with over the years have experienced attachment-related problems. One of the tasks of babyhood is learning how to self-soothe. Many of our clients map over into the adult world an inability to soothe themselves. And so the self-administered touching during the therapeutic processes in experiential somatic therapies are often self-soothing techniques that teach and train a person in these physical skills. I'm also a big fan of tapping techniques. You can think of emotional freedom technique. This is probably the most well-known form of tapping. And tapping, of course, is based on an idea, and the idea that our bodies store energy. This is referred to in Eastern philosophy, in Taoism, as chi energy. Whether you believe the idea of chi energy or not is irrelevant, though, to our bodies, without a doubt, carrying the energies of our experiences. And by tapping, whether it's on the hand, whether it's on the meridian points, other places on the body, and using, this integrates very well with direct suggestion and cognitive therapies, affirmations and suggestions during this process. My clients have, at both a physical level as well as an intellectual level, created catharsis and relief that can be extremely healing to them. Stretching is, of course, another form of manual therapies and self-administered touch. Again, we have constriction when we have trauma, when we have stress, when we have anxiety, when we have unresolved emotions, when we have unrequited love, when we have experiences that are causing us micro traumas or even adverse childhood experiences in which we have recovered from or are in the process of recovering from. And stretching, again, is a way of administering touch to one's own body. Teaching stretching techniques to clients can be a very valuable skill. I'm grateful that I took the course to become certified as a personal fitness trainer, because personal fitness trainers recognize the value of stretching. And this is something that I do incorporate into my processes, encouraging my clients to bring stretching into the therapeutic process. And of course, my favorite technique, I'm a hypnotist, is progressive muscle relaxation. Herbert Benson wrote his book, The Relaxation Response, in 1978, Harvard medical doctor. And his book outlined the massive pile of research that shows that progressive muscle relaxation is a life-changing strategy that not only makes a person feel better, but changes their experience both internally and externally, both mind and body. Herbert Benson spent the last 40 years at Harvard researching progressive muscle relaxation and related therapies, and the body of evidence now is absolutely enormous. Whether it's passive progressive muscle relaxation, which directs a person through a process, relax the muscles of your brow, relax your shoulders, unclench your jaw, or whether it's that's a passive process, or whether it's an active process where they tense and release, tense and release. Edmund Jacobson in 1928 wrote his book on progressive muscle relaxation. It's often referred to as Jacobson's progressive muscle relaxation. 16 muscle groups that he guided his patients through tension and relaxation, so that they could learn intuitively the difference between tension and relaxation. what I have discovered many of my clients are doing is they're walking around life completely unaware of the tension stored within their body. This has both physical and emotional health-related problems and complications. And by training my clients in progressive muscle relaxation, I'm not boring them into hypnosis. What I'm actually doing is providing a valuable training skill set that's useful in everyday life. The last letter in our acronym is S, and it stands for Somatic-Cognitive Integrative Processing. Now, this is where we take the physical, the somatic experiences that we're processing with the client in therapy, and we integrate these into cognitive behavioral approaches, among other cognitively focused approaches. In hypnosis, we might call this direct suggestion. So the value of this is to help connect, again, a conscious mind awareness of the changes that our clients are experiencing at an unconscious physical level through the experiential somatic processes. So what examples of this are there? There are certain brand names, if you will, of experiential somatic therapies. One of these is called somatic experiencing. This is a body-focused trauma recovery method, and it uses cognitive processing to help a person who is engaged in experiential somatic interventions at the end of each session to develop insight and awareness into the experiences. Another approach that is also a brand name of experiential somatic therapies is physiological psychotherapy. This is really an integrative somatic psychotherapy that from start to finish through the processes uses in parallel or in tandem the ideas of cognitive behavioral therapy with experiential somatic processes. What this does is allows a person to create insight and an awareness of feelings, acting, thinking, and to change the firing order. When the firing order, they feel and act before they think, rather than think and then act and feel. And these cognitive behavioral processes, like ACT, antecedent behavior and consequences, can all be introduced throughout the experiential processes in therapy to create conscious awareness of the connection, again, between the physical experiences that a person is having and their emotional and their behavioral output. Another strategy that I like to use with my clients, maybe it's because I've written more than 35 books, is called expressive writing with a somatic focus. This can come in the form of journaling, it can come in the form of creative writing, it can come in the form of even encouraging a person to write their own solutions and to be able to share that then with other people so that they can see how their experiences have benefited others. But writing is in and of itself, well, I guess we usually write with a typewriter now, is a somatic exercise. And writing about the emotions, writing about what my body is feeling can be a healing process. I teach a course called 12weekbook.com. And I've had almost 1,000 people go through that course and write a book. Some people have written memoirs, some people have written how-to books, some people have written self-help books, psychology books, textbooks, children's books. And one of the things I've noticed is that for almost every participant in my book writing course, it becomes a form of therapy for them. It's of the hundreds of people who have taken the course, hundreds of them will tell you it was the most healing endeavor they've engaged in throughout their life. I also utilize in my somatic cognitive integrative processes a technique that is similar to EMDR, but I think it's a technique that has been developed further and is more valuable to those who are looking at creating healing from a somatic perspective, and that is multi-channel eye movement integration. Dr. Mike Denninger is a therapist in Tucson, Arizona, who has written a fantastic book about this subject, has created in-depth trainings. And again, I'm a fan of the multi-channel eye movement integration, which is based on the original techniques of eye movement integration from John Grinder, Connie Ray, and Steve Andreas. And the multi-channel eye movement integration combined with somatic integration and cognitive processing, can help move my clients to a place that they've never been before. The research supports these types of interventions in each one of these 5 areas, and the effects that the research shows are substantial for a wide variety of clients.